Carpal tunnel syndrome, very common diagnosis. In fact, 10% of the population in the United States has carpal tunnel syndrome. So the carpal tunnel is actually, you're talking about an anatomic area or a place in your palm and your wrist where the tendons that bend the fingers, so the 9 strong tendons, move in and out of the wrist. And within that carpal tunnel, or within that canal, is a nerve called the median nerve. And it's the median nerve that's getting pinched. It's not the problem of the median nerve, it's actually the tendons can swell. And this carpal tunnel is a very defined space. It's not a flimsy little canal. It's actually 3 walls of bones. And on the top, or the roof, you're looking at a very thick ligament called the transverse carpal ligament. So what happens over time is some patients can have some swelling in their tendons, the flexor tendons, and the nerve suffers for that.
When the nerve suffers, what does that nerve do? What's it called, and what does it supply in the hand?
It's very common to, like if I always tell patients, everyone's falling asleep on their foot. So
Yeah.
you get up and you stomp your foot and the toes tingle and you get those pins and needles, but it progressively over a minute or so gets better. Well, patients with carpal tunnel may not get that sensation to go away. What happens is that the blood supply actually within the nerve gets cut off or getting pinched. It's basically a way of the body saying, hey, you got to do something, give me a little more oxygen. So patients will feel like they have to wring out their hands. What they're doing in essence is straightening their wrist and letting the blood flow easier through that nerve.
Is it dangerous if it's not fixed? If somebody's having their hand go to sleep, not getting good blood supply, that sounds bad to me.
True. Say a patient has broken their wrist and the blood supply gets cut off very acutely or very quickly, then yes, that's a medical emergency. But most patients with carpal tunnel, you're looking at a timeline where they'll be waking up in the morning and they'll feel their fingers are swollen, and then a month later they may have that tingling that wakes them up, and it'll actually radiate up your forearm. Driving a car, talking on the phone, those things, when a patient will come in the office and they'll say, it's mostly this side, the thumb side of the hand, because the median nerve is responsible really for half the ring finger and all this side on the thumb.
So how do you make the diagnosis?
It's really a clinical diagnosis, mostly history. You'd come into my office and we talk, and as soon as you start telling me, hey, when I wake up at night I have to wring out my hands, generally there's only a few things that will cause that. And then most of the time patients will wring the thumb side of their hand. Diagnostically, I just tap. All you need to do is tap on that nerve and you'll actually excite it and you'll feel tingles. Or put a little pressure on it. Just try to recreate what happens at night, because everyone, when they sleep at night, well, most people, we all sleep like babies, so our wrists are flexed. So the number one thing I'll tell patients is, well, why don't we start off with a wrist brace? Get a wrist brace on, just wear it lightly at night, and that might just help you keep your wrist straight. That may just keep you out of trouble.
Can you correct it with surgery?
Yes.
What do you do?
Surgery basically is where a carpal tunnel release. So you're actually just making an incision and releasing the ligament right here in the palm. And if you look at the ligament, it's not a ligament that you could stretch or bend, or it's a very thick ligament. So when you release it, you release it up over the small finger side, so it'll open up like a sunroof. And how I kind of will say that is, here are all the tendons tightly trapped, you open it up and they're able to
breathe again. The blood supply comes back.
And then the nerve can breathe a bit.
Do you have to cut it and sew it together? Do you have to cut it all the way off? Do you just sort of open it up so it'll sort of come out?
Right. No, the ligament actually, you just release the ligament and it slides over, and basically you can leave it like that. There's really no functional need for the transverse carpal ligament, or the ligament that causes the carpal tunnel. How
long does it take to recover once you've had that ligament released?
Well, you really want to start moving right off the bat. I mean, the post-operative course really is just a light dressing. Something where you're able to use your fingers, move your hand. I mean, I'll joke with patients, don't jackhammer, don't lift really heavy things, but really you can go back to work within a day or two.
Go back to typing,
Absolutely.
going back to doing manual work. You want them to do that.